Hi everybody, I'm Mike Putman, reporting for Room Now from ACR 2019, and I want to talk about an exciting presentation that I saw this morning on the 2019 guidelines for the management of giant cell arteritis. Three things in particular I wanted to highlight. The first one I think is going to be somewhat controversial. They recommended temporal artery biopsy over temporal artery ultrasound for the diagnosis of GCA. I know our European colleagues are especially enthusiastic about temporal artery biopsy, or temporal artery ultrasound, and it's something that I myself use, especially in patients who have what I consider to be a high pretest probability. The second thing that they recommended, that is something I've been doing in my practice and have been advocating for, is leading with tocilizumab up front. The GIACTA study to me was convincing that this is a steroid-sparing agent that's good for our patients, and the new ACR guidelines reflect that. It's interesting because that's actually not what the EULAR guidelines recommended. They recommended a different approach up front for patients with giant cell arteritis. And last but not least, they did recommend large vessel imaging, which I thought was interesting. That's something that I have been doing in patients who have symptoms, but I think they're emphasizing the fact that a lot of patients who have large vessel imaging wind up getting missed. Very interesting guidelines, and some that I think will be very useful for all of us who treat giant cell arteritis. For more information, please go to the website at roomnow.com.